The Belmont Report, an application to the condom use case study, presented by Kylie Chisholm. The case study question that I am addressing is question number 4, which states, based on the ethical principles outlined in the Belmont Report, describe the ethical issues that should be considered in the condom use promotion programs. How did or did not the program's planners address these or any ethical issues? How would you have addressed these ethical issues if you were the program planner? What is the Belmont Report? The Belmont Report was created by the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research on April 18th of 1979. It is a summary of basic ethical principles and guidelines that assist in resolving the ethical problems that surround the conduct of research with human subjects. There are 3 principles to the Belmont Report, which consist of distinction between research and practice, a discussion of the 3 basic ethical principles, and remarks about the application of these principles. Part A. Boundaries between practice and research. Research and practice often occur together. Practice refers to interventions that are designed to enhance the well-being of an individual patient and that have a reasonable expectation of success by providing diagnosis, preventative treatment, or therapy. Research is an activity designed to test a hypothesis, permit conclusions to be drawn, and to contribute to knowledge. Research and practice may be carried together when research is designed to evaluate the safety and efficacy of a therapy. Boundaries between practice and research, an application of the condom use case study. The overall goals of the project were to reduce HIV incidence by increasing access to condoms, increase consistent condom use among the target population, improve access to proper treatment for sexually transmitted infections, and create demand for proper STI treatment. Improving access to proper treatment for sexually transmitted infections and creating demand for proper STI treatment is the area where practice and research in the case study overlap. Preventative treatment for those who already have an STI is a major necessity in southern India. And advising those who have been in physical contact with sex workers to get tested for HIV and STIs could save their lives. 3 basic ethical principles. Basic ethical principles can be described as general judgments that serve as basic justification for many ethical measures and assessments of human subjects. The 3 basic principles are respect for persons, beneficence, and justice. The first principle, respect for persons, includes 2 ethical beliefs. First, individuals should be treated as autonomous or free agents. And second, persons with limited autonomy are entitled to protection. Respect for persons demands that subjects enter into the research voluntarily and with adequate information to situations. The second principle is beneficence. Beneficence is making sure persons are treated in an ethical manner and by making efforts to secure their well-being by maximizing benefits and reducing potential harms. The third principle is justice. Justice can be described as fairness in distribution of burdens and benefits, or what the people participating warrant. There are several ideas of just ways to distribute burdens and benefits. These ideas are: to each person an equal share, to each person according to individual need, to each person according to individual effort, to each person according to societal contribution, and to each person according to merit. 3 ethical principles and application of the condom use case study. Number 1, respect for persons. Project designers sought to learn where to reach the greatest numbers of male clients of sex workers and what level of contact was needed to convert inconsistent condom users into consistent condom users. The program designed street theater, interpersonal communication discussions, and small group activities to aid in educating male clients of sex work. These individuals were free to come and go as autonomous agents on the street while the programs were being held. Number 2, beneficence. The case study's goal was to reduce harm to those partaking in sex work by educating them on using condoms consistently, in hopes of reducing the risk of getting an STI. Number 3, justice. Men of sex work were treated as equals during the entire process and were never judged by their actions. Part C, application. The first principle of application is informed consent. This requires that subjects be given the opportunity to choose what shall or shall not happen to them. The consent process consists of 3 elements: information, comprehension, and voluntariness. Information about risks should never be withheld for the purpose of eliciting the cooperation of subjects, and truthful answers should always be given to direct questions about the research. Also, care should be given or taken to distinguish cases in which disclosure could invalidate the research. Comprehension can be described as the manner in which information is conveyed to the subject and their ability to understand the information and potential risks that could be involved. Voluntariness is an agreement to participate in research, which constitutes a valid consent only if voluntarily given. The second principle is risk-benefit assessment. This presents an opportunity and a responsibility to gather systematic and comprehensive information about the proposed research. The term risk refers to the possibility that harm may occur. The term benefit refers to something of positive value related to health or welfare. Risk to the subjects must be outweighed by the sum of both the anticipated benefit of the subject and the anticipated benefit to society in the form of knowledge to be gained from the research. The third principle is selection of subject research. This is the principle of justice that gives rise to moral requirements and that there be fair procedures and outcomes in the selection of research subjects. There are 2 levels to this: social justice and individual justice. Social justice requires the distinction be drawn between classes of subjects that ought or ought not to participate in any particular kind of research. Individual justice requires that researchers exhibit fairness. They should not offer potentially beneficial research only to some patients who are in their favor, or select only undesirable persons for risky research. Application and how it's applied to the condom use case study. Number 1, informed consent. The program was done on a voluntary basis, and those partaking in the program were allowed to come and go whenever they wished. 2, risk-benefit assessment. There was a fair balance between the two. The harms were likely to be reduced if the individual partook in consistent condom use, and the benefit of that was with consistent condom use, there will be a reduced risk of getting an STI. 3. Selection of subjects of research. The selection was done on a basis of the highest sex work activity and the highest rate of HIV infection in southern India. How would I address these ethical issues as a program planner? In addition to the case study, some additional suggestions that I would make are: first, I would educate individuals on why STI treatment was helpful and why, as well as advise males of inconsistent condom use and sex work to get tested periodically for STIs. This can help save their life. When it comes to informed consent, I would have those that met in group discussions sign a form stating that they comprehend the information and consent to participating in the discussions. Other than these areas, I would have addressed the case study the same way that the program planners in the study addressed it. I think that they did a very thorough job addressing each area that the Belmont report discussed.